Hi, my name's Christian Eccles. I'm an orthopedic surgeon that specializes in hip and knee replacement surgery. So you've made the decision to have a knee replacement surgery. This video is going to talk about the important things pertaining to your big day and make sure that you know exactly what you need to do in order to have a successful outcome. We will schedule you for pre-admission testing prior to your surgery with one of our medical practitioners for a detailed medical exam. We will also send you for specific blood work and various tests that you may need, such as a chest x-ray. It is very important that if you see any specialty doctor, such as a cardiologist, that you go to them and tell them that we need medical clearance in order for you to have knee surgery. A week or two before your surgery, you will also come back to clinic and meet again with me. On the day of surgery, you will arrive to the hospital, change, be taken back to the OR, and an anesthesiologist will typically give you a spinal block, which has been shown to be one of the safest ways for a total joint replacement. This will make you comfortable for surgery, which typically takes about 1 to 1.5 hours. You will then be transferred to the recovery room where you will start waking up again. Once the spinal block wears off, you will start working with one of our physical therapists and will start walking just hours after the procedure. The vast majority of my healthy patients are discharged the same day from the hospital and are able to be in the comfort of their own homes. There are many benefits to doing this and having this as your goal. You are required to do physical therapy after your knee replacement surgery. It is extremely important that you ice and elevate your operative leg at least 3 to 4 times a day for 30 to 45 minutes. This helps control the swelling, which in part helps you get better motion, which then improves the pain from surgery. The only way to appropriately elevate your leg is to have your toes above the nose. It doesn't matter whatever you use for ice, whether it's an ice machine, an ice pack, or even a frozen bag of peas. You just have to do this. Sitting in a recliner with your leg extended is not elevating your leg high enough. Again, you have to have your toes above your nose in order for the fluid within the leg to get back to the rest of your body. It is your responsibility after surgery to regain your motion. I do not leave the operating room until I am satisfied and I can get your leg fully straight and bend it completely, and therefore I know that the parts that I put in are able to do that. Pain and swelling after surgery causes stiffness. You need to aggressively work on fully straightening the leg as well as bending it so that you can do everything that you want to in the future. A sterile dressing will be applied in the operating room. This should be left on until your 2-week follow-up with me. You can shower normally. It is water resistant but not waterproof. We want to keep the water out. I will then remove it and you can continue to shower normally. Do not soak in a pool or a tub until I tell you that you can. If you notice any bleeding on the dressing, it can be normal if it is less than a quarter size, but if it's anything larger, please contact me or the office immediately. Unfortunately, pain, swelling, bruising, and discomfort are very expected after surgery. No pain is not a reasonable expectation after a knee replacement surgery. The greatest secret, again, is to ice and elevate, and week by week, you will continue to feel better. Your incision as well as everything internally will heal over time and will stay red and purple during the healing phase until it completely matures over many, many months. Unless you have allergies or are otherwise instructed, some of these medications may include taking aspirin to reduce your chance of developing blood clots, cefadroxil, which is an antibiotic, Tylenol, which helps with pain, and Celebrex, which also helps with pain, swelling, and inflammation. Do not miss a dose of all of these as they are prescribed to you. You will also be typically given 1 or more narcotic pain medications if the previous medications do not control your postoperative pain. Tramadol is a strong narcotic medication and oxycodone is even stronger. Take these only as needed and as prescribed, as they are addictive and can be dangerous. Typically, most patients need the oxycodone for the first week or so, and they use the oxycodone before their therapy visits or in order to sleep at night, and then they transition to tramadol. While you will be feeling much better in the first few weeks after surgery, full recovery can take up to a year after a knee replacement. Continue to be patient and continue to strengthen your new knee and control the swelling. If you do this, you will be able to get back to the activities that your arthritis is preventing you from doing now. Thank you for taking the time to watch this video. Please do not hesitate to reach out to us with any questions that you have. We look forward to working with you. If you would like to learn more, please visit southcarolinahipandknee.com